Brains. Brains. Let's talk about brains.
So here's a whole brain, and here's the cerebellum!
When looking at the cerebellum, which in Latin means tiny brain, the first thing we see is the incredibly large number of folds, which function to dramatically increase surface area. These folds also divide the cerebellum into three lobes. The anterior corpus cerebelli in purple and the posterior corpus cerebelli in green are separated by the primary fissure, while the flocculonodular lobe, shown here in yellow, is separated from the posterior corpus cerebelli by the posterolateral fissure. In addition to these lobes, the cerebellum is also divided into three zones, although these zones lack the defined boundaries of the lobes. The vermis, derived from the Latin word for worm, is located centrally and separates the two hemispheres of the cerebellum. Adjacent to the vermis is the intermediate zone, bordering the vermis on either side, and directly lateral to the intermediate zone is the lateral hemisphere. Functionally, the cerebellum is also divided into three parts, and all outputs originate from one of the four pairs of deep nuclei, depending on where the information is being sent. The cerebrocerebellum consists of the lateral hemispheres and the dentate nuclei, and is the largest of the three functional divisions. Involved in motor planning and learning, its primary inputs are from the cerebellar cortex and the pontine nuclei, with outputs to the thalamus and red nucleus. It is also involved with coordinating muscle activation and is vital in conducting visually guided movements. Additionally, this region is involved in the cognitive functions associated with the cerebellum. The next region is the spinocerebellum, made up of the vermis, intermediate zone, vestigial, and interposed nuclei. As the name implies, this region receives information from the spinal cord as well as the cerebrum. Outputting signals to the rubrospinal, vestibulospinal, and reticulospinal tracts allows this region to integrate sensory input and motor commands for adaptive motor control.
Lastly, the vestibulocerebellum, comprised of the flocculonodular lobe, receives input from the lateral vestibular nuclei, the semicircular canal, the visual cortex, and the superior colliculi. By outputting back to the lateral vestibular nuclei, a circuit is created that allows us to maintain balance and posture. The vestibulocerebellum is also involved with the optic reflexes, which allow us to track and focus on objects.
Functions of the cerebellum are maintenance of balance and posture, coordination of voluntary movements, so the left side corresponds to the left side of the body and the right side corresponds to the right side of the body, motor learning, and cognitive functions. If damaged, some side effects are decomposition of movement, unintentional tremors. So here we see a person with cerebellar damage. Patients with cerebellar damage also can't pass the sit and tap test. While sitting, one should be able to raise his or her hand and tap his nose. This should be no harder with his eyes closed. However, a person with cerebellar damage often moves their joints independently and pokes themselves in the face.
Well, I guess the look I'm best known for is blue steel.